1980s Common Craft video AIDS by Brianna Santella, Michaela Fritsch, Rebecca Verkaman, and Dan Cady. During the period of the 1980s, a new disease spread among American society in an unprecedented growth. The illness was completely foreign to American doctors and society as a whole. What it was and what caused it could not be identified by those who studied it. AIDS proved to impact the physical health of individuals as well as their social and mental health. The emergence of AIDS created not only a medical crisis but also perpetuated stereotypes against certain groups in society. Today we know this epidemic as AIDS, a disease that focuses on and attacks a person's immune system. The causes of this disease were not apparent in the 1980s, though there have been theories. One of the theories stated that AIDS was a branch off an African monkey virus called SIV. They believe that human contact with the chimpanzees increased the growth of AIDS among the human population. Once it enters the body, it begins to attack the helper T cells. These cells are responsible for maintaining the strength of the immune system by attacking viruses that enter the body. However, once these cells are destroyed, the body becomes unable to fight off viruses, and the person will grow progressively sicker. This was a mysterious disease in the 1980s. At the beginning of the decade, doctors began to notice that this disease occurring in initially small numbers of younger males in California and New York. These men were becoming very susceptible to fatal illnesses that indicated an extremely weak immune system. The first cases were reported in 1981. A group of workers at an Atlanta Center for Disease Control eventually discovered that it was transmitted sexually. Not only that, but they also discovered that it was spreading rapidly through the gay community. This news was followed by a story released by the New York Times that told of how most homosexual men had gotten the disease. This began to create an entire stigma against the gay community. By the end of April 1982, 248 gay men had been diagnosed with this disease. At first, it was referred to as gay-related immunodeficiency. By January of 1989, there were 82,764 cases of AIDS in the United States and 46,344 deaths. Eventually, society came to realize that AIDS did not discriminate against any specific gender or sexuality. This was the point at which homophobia peaked. People were terrified and were receiving no reassurance to quell their fears. President Reagan, for most of the decade, did not regard this issue with much importance. By not assuring the public that basic contact would not transmit the disease, he helped perpetuate the fear that discrimination would build up. People who had already been homophobic took advantage of the situation and continued to perpetuate the idea that this was a punishment for homosexuals. AIDS was called gay plague and even gay cancer. Violence towards homosexuals increased dramatically. They became isolated from the community as a result of an increase in homophobia. The press was becoming more anti-gay, calling AIDS the gay plague and gay cancer. Jesse Helms, a Republican senator from North Carolina, amended a bill to prevent funding for AIDS education in a way that encouraged or even addressed positive homosexuality. A conservative student from Dartmouth College published the names of assumed gay peers in the school magazine. These were incidents that represented the hatred and fear directed towards the gay community. However, the gay community did begin to fight against the stereotypes. Activists frequently spoke out against these stereotypes. ACT UP was founded to confront the discrimination. The American Medical Association eventually ruled that physicians had to treat those infected with AIDS. This was the beginning of a strong fight against the disease, as well as the social stigmas that resulted from it. That fight continues today.